Have you ever paused to think about what you would do if a heart attack hit, and you were entirely alone? It's a frightening scenario, but sadly, it's more common than many of us realize. A lot of people assume they'll have time to react, or that someone nearby will step in. But the truth is, those first few minutes are absolutely crucial, and what you choose to do, or don't do, can mean the difference between life and death. Here's the good news. Even if you live by yourself or often spend your days alone, it's still entirely possible to survive a heart attack. The key is acting fast and knowing exactly what steps to take. In this video, we'll walk you through 7 essential things to do the moment a heart attack begins and you're the only one around. These steps are practical, simple, and they save lives. You don't need a medical background or fancy gear. You just need a calm mind and a little preparation. We'll explain it step by step. How to identify the earliest warning signs, what to take immediately, how to keep your heart from working too hard, and which small actions could give you just enough time to get the care you need. Be sure to stay until the end, because the final steps are often overlooked, and they might be the ones that ultimately save your life. Don't wait until you're in crisis to learn what your body is trying to tell you. Let's begin. First, recognizing the earliest warning signs. This is the most vital part of surviving a heart attack when you're on your own, knowing what it actually feels like. And not just in your chest, but throughout your entire body. Most people picture that dramatic movie scene, someone clutching their chest in agony. But in reality, heart attacks usually start with subtle signs. Those quiet early symptoms are incredibly easy to dismiss until it's too late. So what should you look out for? One of the most common sensations is a deep, uncomfortable pressure or tightness in the center of your chest. It might feel like there's something heavy pressing on you, or like your chest is slowly being filled with cement. The feeling can come and go, which makes it even more tempting to ignore. But if it lingers for more than a few minutes or keeps returning, don't make excuses. Other early signs might include shortness of breath, even if you haven't moved. You could feel like you've just climbed a steep hill, even while sitting still. Some people experience pain that radiates into the arm, shoulder, neck, or jaw. Others report feeling lightheaded, nauseous, cold and clammy, or unusually dizzy. For older adults or women, the pain might not even center in the chest. It may feel more like pressure in the upper back or stomach. Take Richard, age 74. He was sitting at his kitchen table when he noticed an odd tightness beneath his collarbone, almost like indigestion. But then he realized he couldn't draw in a full breath, and his hands started sweating. He remembered reading that not all heart attacks start with dramatic chest pain, so he acted. That decision may have saved his life. Remember, the body often whispers before it screams. And with heart attacks, those whispers might be your only chance to act before irreversible damage occurs. If you wait for that classic dramatic pain, it could already be too late. So if you ever feel something strange, especially a mix of pressure, breathlessness, or sudden fatigue, don't try to tough it out. Don't shrug it off as something minor. Taking those signals seriously could be the first step towards staying alive. Next, calling emergency services immediately. As soon as you suspect that a heart attack might be beginning, the very next thing you must do, without waiting or second-guessing, is dial 911. Don't give yourself time to wonder if you're overreacting. Don't drive yourself to the hospital, and don't wait to see if the discomfort fades. That delay could cost you everything. Calling emergency services is the single most important move you can make. When a heart attack strikes, every minute counts. The longer your heart goes without enough oxygen, the more damage builds up. But calling 911 means trained paramedics are on the way immediately. They're bringing critical equipment, medications, and tools to keep your heart going if it stops en route to the hospital. And here's something many people don't realize. Symptoms often worsen rapidly. So even if you think you're doing okay in the moment, you might not be able to help yourself 10 minutes later. That's why trying to drive yourself is dangerous. You could lose consciousness mid-journey, putting both yourself and others at risk. It's simply not worth it. Think of Linda, 78. She felt an odd ache in her left shoulder, followed by nausea and a wave of clammy sweat. She considered calling her son, but remembered a nurse once told her, "Call 911 first, talk to your family later." She took that advice. By the time the ambulance pulled up, her symptoms had escalated, but the emergency crew was ready and stabilized her on the spot. That one phone call made all the difference. You don't have to be sure you're having a heart attack to call for help. Dispatchers are trained to handle uncertainty. They'd rather send help you don't end up needing than arrive too late. Keep your phone somewhere easily reachable, especially if you live alone. If your speech becomes slurred or difficult, use the emergency call feature. Many phones now have shortcuts to call for help even when locked. Know where yours is and use it. Now onto a simple but powerful next step, chewing an aspirin slowly and calmly. After you've called for help, your next move could be the one that keeps your heart from worsening. If you have access to a 325 milligram uncoated aspirin, chew it, not swallow, chew. Do this even if you're trembling. This can greatly increase your odds of surviving. Why aspirin? It thins your blood, helping to reduce or slow the growth of the clot, likely blocking your coronary artery. That clot is what's cutting off oxygen to your heart. By chewing rather than swallowing whole, the aspirin enters your bloodstream faster, possibly fast enough to restore some blood flow before paramedics arrive. It's best not to take aspirin on an empty stomach, but during a suspected heart attack. Preventing further clotting is the priority. If all you have is a coated or delayed-release tablet, chew it anyway. The speed of absorption is what counts. Let's talk about Joe, age 72. One morning, he felt a tight band squeezing across his chest, moving upward to his jaw. He remembered his emergency aspirin tucked in the kitchen drawer. He chewed one, then waited seated until help arrived. His cardiologist later told him that small action likely lessened the damage to his heart. If you live by yourself, make sure aspirin is always easy to find. Keep some in your nightstand, your kitchen, your car, or even your wallet. Replace it before the expiration date. And let your loved ones know where you store it in case they need to help you. It might seem too simple, but emergency responders around the world use the same practice. Chewing an aspirin isn't a tip, it's an evidence-based intervention. And in those early minutes, it might be all you need to hang on. Once that's done, sit or lie down. You've called for help, you've taken aspirin. Now your job is to do as little as possible. Find the safest and most comfortable position, ideally sitting upright, back supported, feet flat. The less effort your body makes, the less oxygen your heart needs to pump through a partially blocked artery. If you feel faint, lie on your side with your head slightly elevated. Do not try to unlock the door, clean the house, or gather your ID unless it's essential and nearby. Every ounce of effort drains your reserves. This isn't the time to power through. That mindset might have served you well in life, but here, it could hurt you. Alice, 81, felt sudden chest pressure as she stood washing dishes. Her first instinct was to clean up and get organized, but she remembered something her doctor said. If you think it's your heart, sit down. Everything else can wait. She sank into her recliner and waited. That stillness likely kept her from tipping into cardiac arrest. Here's a quick tip that's often missed. If your chair doesn't have armrests, don't let yourself slump forward. Keep your spine supported and your breathing as open as possible. The more relaxed and stable your posture, the less strain your heart faces. This isn't about doing nothing. It's about doing the most important thing, surviving until help arrives. If you still have a bit of strength, one more important task: unlock your front door. It might seem like a minor detail, but in an emergency, every second counts. Paramedics can break in if they have to, but that causes delays, damage, and may put you at risk if you're near the door. Unlocking it in advance allows emergency responders to get straight to work without barrier or confusion. If you live in a gated community or an apartment, think about access now, not later. Do you have a lockbox, a visible address, a key someone nearby can access? Take Paul, age 76. When his symptoms started, he called 911, chewed an aspirin, then unlocked the door before sitting down. Paramedics reached him within minutes, no delay. That door, one responder later told him, gave us an extra 30 seconds we didn't have to waste. If you're too far from the door or feel unsteady, don't force yourself. Staying safe is still the top priority, but if you can unlock it without overexertion, do it. Consider investing in a smart lock or key box, especially if you live alone. It's a small gesture of preparation, but it tells the emergency team you've done your part. Now it's their turn. Your phone is also more than just a tool, it's your lifeline. One quick step: turn on speakerphone. This lets you speak with the dispatcher while keeping your hands free. Holding the phone to your ear may seem harmless, but during distress, even that effort can affect your breathing and concentration. With speaker on, the dispatcher can hear changes in your tone, your breathing, and can stay on the line longer without you needing to press anything. If you become too weak to speak, they'll still be able to listen for any sign of distress. Also, make sure your medical ID is set up on your phone. Both iPhones and Androids have emergency features accessible from the lock screen. Include your name, allergies, conditions, and emergency contacts. Susan, age 79, collapsed just minutes before EMTs arrived. But thanks to her phone's emergency settings, responders knew she was diabetic and allergic to penicillin. They avoided harmful meds and reached out to her daughter on the spot. Lastly, your breath. Yes, your breath can help. During a heart attack, anxiety can spiral, making your heart race faster. But controlled breathing can slow your pulse and prevent your body from slipping into full panic or shock. Try this. Inhale slowly through your nose for 4 seconds, hold briefly, then exhale gently through your mouth for 6 seconds. Do this repeatedly. That rhythm acts as a calming anchor. It helps regulate your nervous system and may prevent arrhythmias caused by panic. Frank, 83, said it best. I just kept thinking, stay calm, stay alive. When his symptoms hit, he focused on his breath. When help arrived, his heart was unstable, but not in full arrest. His calm might have bought just enough time. Surviving a heart attack alone doesn't depend on luck. It depends on knowing what to do and doing it with calm urgency. Recognize the signs, call for help immediately, take aspirin if possible, stay still, make your home accessible, use your phone wisely, and breathe with purpose. Together, these small, deliberate actions can form a powerful chain of survival.